Hey everybody, it's Melin here with Women's Wellness Collaborative, and today I'm going to talk to you about Candida. So a lot of the clients who Bridget and I work with are pretty up to speed on Candida. Many of them come to us already talking about symptoms of Candida. They'll often list that it's something that they've dealt with in the past or are currently dealing with on their intake forms. I know as we begin to work with them, it's something that a lot of people who are paying attention in the natural health space and the digestive health space are kind of aware of. Unfortunately, it's not something that people have a really great understanding of how to how it actually interacts with other things that may be going on with the digestive system. So it's kind of one of those things where people recognize that they may have certain symptoms that are indicative of Candida, and then they start going after the Candida with all kinds of incredibly restrictive diets and herbs and all of that, and those things are great, and they do definitely have their place, but you have to know when, and you have to know that you're approaching it properly and at the right time. So that's the biggest thing that I see, is that there are commonly other things that need to be dealt with first, and if they're not, your Candida is just going to grow back as soon as you introduce anything else into the diet, as soon as you stop taking your herbs. So that's where we're going to start off today. I'm going to give you a little primer on Candida and go from there. All right, so what is Candida? So Candida is actually a yeast, which many of you probably know. It is considered to be a normal part of the microbiome. So the microbiome being the word for all of the microorganisms that live in our guts. Commonly that's how it's used, but we have microbiomes on our skin and in all of our mucosal passages as well. But when we talk about microbiome here, we're pretty much talking about the gut. So it is a normal part of the microbiome. It's also an opportunistic organism. So what does that mean? That means that it likes to grow and overgrow when it has the opportunity to do that. So in that way, it's often secondary to other infections. So things like certain kinds of parasites, certain kinds of bacteria, they will kind of set the stage that creates a system, an ecosystem of inflammation or poor gut ecology. And when that's happening, then Candida really finds its chance to proliferate. Things like sugar also tend to feed it substantially, so that's another way in which it's opportunistic. It is found in pretty much all of the mucosal barriers of the body, so in the GI tract, in the vagina, in the mouth, right? We commonly hear about vaginal yeast infections, and those tend to be driven by Candida in most cases. Generally speaking, Candida is mitigated by normal bacteria. So what I mean by that is that if you have sufficient amounts of good, healthy, beneficial bacteria, that will generally prevent Candida from overgrowing. So if you have a healthy microbiome with a lot of good, healthy bacteria, Candida won't be able to find a place to take hold. Part of the problem and the relationship to antibiotics in this case comes about because antibiotics will often kill off the really good bacteria that are in your gut. And when that happens, then Candida has an opportunity to grow in that space. And I can remember even back to when I was a teenager that my doctor was recommending that I eat yogurt when I take antibiotics, sugary yogurt, but nonetheless, that was something that was being recommended because they were even aware of it back then. Another interesting thing is that Candida and mercury tend to like each other, so that's another way in which it could be a secondary infection. So if you have a lot of mercury toxicity, your body may actually try to protect itself from that mercury by overgrowing Candida. So if somebody has kind of dealt with all other gut infections and the Candida continues to recur, then sometimes I'll start suspecting metals like mercury. I already mentioned that it thrives off sugar. So sugar and certain kinds of carbs, Candida just loves. All right, so symptoms. Some of the common symptoms are kind of gastrointestinally related, things like gas and bloating and abdominal pain and constipation and diarrhea. So these are things that can be symptoms of other gut infections like SIBO, like parasite infections. So sometimes those symptoms can mirror infections from other things. Um, Fatigue is really common with Candida, as is brain fog. Brain fog may be one of the most common symptoms with Candida. As we talked about, vaginal yeast infections, even headaches and joint pain, skin conditions. Sometimes people will even have fungal kinds of rashes on the skin that are related to Candida. Sugar and carb cravings, because it's actually crazy, but the Candida will hijack your neurotransmitter systems and send impulses to your brain that cause you to crave the sugar and carbs that the Candida wants to feed itself. And anxiety and depression are quite common byproducts of Candida overgrowth as well. All right, so then in terms of testing for Candida, there are a couple of different ways to do it. Most often, with almost all of the clients that Bridget and I work with, we do run a stool test. And the stool test does look for Candida and other kinds of yeast and fungi. Stool testing, and depending upon what else is going on with the gut, I think there can be a fair amount of false negatives when you're doing stool testing for Candida. Quite often I use stool testing as a screen for other more primary infections, though Candida does show up a lot on the GI map, which is the test that we are using for that, and as do other yeasts and fungi as well. However, in a lot of cases, it could still be a false negative. I think that organic acids testing is probably the best way to check for yeasts and Candida. I don't usually run organic acids tests unless I'm wanting to look at a number of other things as well, because it's kind of a pricey test, and it has, they generally have something like 70 markers on them. So I don't want to run an organic acids test just to look for Candida, but I think it is probably the best way to look for it if there are other things you want to see there as well. In terms of doing a protocol to overcome a Candida overgrowth, there are some great herbs for it that will help to kind of kill off and dial back the levels of Candida. So you want to do that piece of it, and then you also want to be making sure that you're rebuilding by adding back in the beneficial bacteria that probably aren't there to keep the Candida in check. So that's something else that you want to do. An anti-Candida diet is also generally necessary in some degree in order to cut back on the kinds of sugars and carbs that the Candida will feed on and allow it to perpetuate itself. Quite often, in these cases, we also want to consider, because a lot of times Candida occurs because of a poor gut ecology. So you'll also want to think about not just killing off the Candida, but how to restore a healthy environment in the gut so that there isn't the kind of inflammation and the kind of gut ecology that allows for the Candida to grow back. Just killing it is usually not enough. You have to really be aware of what else is happening in your gut, and to heal up the gut and to reduce inflammation and calm that whole system down so that it's a really healthy environment so that the Candida doesn't grow back.